We're back here on the Lynn Hayes Freeland Show. We move now from natural products to a much more serious subject, and it is a subject about our babies, what's happening to our babies, and how we as a community need to get involved in the conversation. Three guests today, three perspectives on a very serious subject. To my immediate right is Doretta Lemon. She is a registered nurse. She's a member of Pittsburgh Black Nurses in Action, as well as a board member of the March of Dimes. She's been on the board since 2012. Sitting next to her, Dr. Betty Braxter. She is also a CNM, which is a certified
nurse midwife.
Nurse midwife. She too is a member of the Pittsburgh Black Actions in Nurses in Action, as well as an assistant professor at the School of Nursing at the University of Pittsburgh. Rounding out our panel is Dr. David Logan. He's the medical director of obstetrical services at Jefferson Hospital, and I welcome you all to the show.
Thank you.
Thank you.
So, Doretta, talk to me a little bit about, I think I'm somewhat disheartened because what we're here to talk about is basically infant mortality. And it's a subject that we talked about 20 years ago that I feel like we shouldn't have to talk about in 2019.
Well, we need to talk about it because it's very urgent what's happening right now with premature births. And being part of the March of Dimes, I'm an advocate for moms and babies. Mm-hmm. That was what I did in my work at the. And a lot of people don't know about the March of Dimes, really. They know the old things. I remember even being around 9 years old with my mom and a little card.
Oh, yeah.
And we went around the neighborhood and we put dimes in the slot and we turn it in. Mm-hmm. The March of Dimes is actually leading right now in the fight for health of moms and babies. They believe that every baby should deserve a best possible start, but unfortunately, that's not always true. Mm-hmm. The March of Dimes is trying to change that. Moms and babies are facing an urgent health crisis. In the U.S. right now, we have the worst rates in the world of maternal death and infant death, yes. Mm-hmm. Women of color have a rate over 3 times higher than any other women in this country.
Wow.
In this country, yes. Women of color are up to 50% more likely to give birth prematurely, and their children can face 130% higher infant death rate, and this is alarming.
It is, in fact. You know, I'm letting you read off that paper. I should have taken that paper from you because I know that you know
I do.
all this information
but I
that you're
make
reading
sure I forgive it.
from the paper.
Don't forget
indeed.
anything. Making
Now,
sure I don't forget anything.
So, Dr. Braxter, what are some of the issues? Are they prenatal care? Are they lack of access? What are we talking about here?
So we're typically talking about at least 4 areas. One is accessibility. Mm-hmm. Yes. The other is economics. Another one is the interventions that are available, and we always talk about social determinants of health. So at least those 4 are contributing. We have other factors like stress. Stress has been linked to increased risk for prenatal or preterm births. We have other issues like interpersonal violence or intimate partner violence, another factor associated with preterm birth. So there are a myriad of factors coming together that are giving us our high preterm birth rate. And as Doretta has said, and Dr. Logan will speak to, we have the best medical care in the world, and we spend the most money. But this is a problem that's been around. And locally, the Allegheny County Health Department, there was a decrease in preterm births between 2008 and 2016. Okay. Now we're seeing a bumping up.
It's going back up.
It's going back up.
Now, and Dr. Logan, let me ask you this because, we bill this area as, you know, the area of eds and meds and all of these wonderful medical facilities. So where is the breakdown? Where does the gap happen? Where's the breakdown?
You're right.
Happen?
We have, we have many great hospitals, but 2 tremendous health centers, the University of Pittsburgh Medical Center and Allegheny Health Network. And we have so much opportunity for women to receive their prenatal care, but the breakdown sometimes is the accessibility. We've faced multiple crises in obstetrics, And one of the crises is the malpractice problem, which helps to drive physicians and nurse midwives out of the community. And we've closed so many labor and delivery units just right here in our own local area. Shadyside Hospital, Allegheny General Hospital, North Hills Passavant. Most recently, in the last several months, Uniontown Hospital. So I'm the director at Jefferson Hospital for Allegheny Health Network, and now these poor patients are traveling 40 miles just to come for a checkup, and 40 miles from Uniontown to Jefferson Hospital just to deliver a baby, and sometimes they're delivering en route. And also some of our areas are just so troubled by another crisis, drug use and heroin. So there's just so many factors that lead to these poor outcomes despite our wonderful health system.
So Dorota, I mean, yeah, that's something I hadn't even thought about. I mean,
Yes.
we have seen this opioid crisis affect so many communities
Yes.
on so many different levels, and that's got to be an impact here as well.
Yeah, that's one of the factors, definitely. But there are other factors also that even in working as a visiting nurse in a program for first-time moms and babies, a lot of the girls, when they weren't doing their prenatal visits, it had a lot to do with how they were treated whenever they went to their prenatal visits. Sometimes they wouldn't go back because they would tell me things like that. So the sensitivity also was part of it, the drugs, and many of the other things that we've spoke of right now today.
And and you mentioned that, and I always tell people that accessibility means a lot of different things. It can mean the ability or inability to get there, but it can also mean the way people make you feel
When you get there. That's right.
And that is important.
And we're seeing that in terms of accessibility and the intersectionality with ethnicity, race, where you live, all of those things come into bear. And one of the other issues that Dr. Logan was addressing is the need to, once you think you're pregnant, to get prenatal care early and not to wait. And some people will do that because of various reasons. But the earlier you can get prenatal care, that increases the likelihood that you will be healthy. Mom has to be healthy to have a healthy
baby.
And moms sometimes have chronic diseases and other issues that if they were able to come in on, like within that first 12 weeks, it can help they can be monitored to reduce the risk for a preterm birth or adverse outcome.
This is heavy lifting. We got a lot of work to do. We're going to take a commercial break and try to dig into some of all of this when we come back and give some phone numbers where folks can get information.
Yes,
All right.
yes,
All right.
absolutely.
Resources.
Yeah, we got a lot of work to do. Stick around when the Lynn Heath Freeland Show continues.